Good evening, everybody. We'll start with today's session. So, dear friends, we are discussing regarding the homeopathic management of chronic diseases, right from aphorism number 171. And he started with the first variety, that is the one-sided diseases. The diseases with very few symptoms, which are labeled as the one-sided diseases. And in order to explain the homeopathic management of them, he classified it into two types: the one-sided diseases of internal variety and one-sided diseases of the external variety called as local diseases. In detail, we have learned about the homeopathic management of one-sided diseases of internal variety, and later on we have started discussing about the homeopathic management of local diseases right from aphorism number 185. Again, for the purpose of understanding how to manage those local diseases, he classified the local diseases into two types. The first variety is local diseases because of some external cause. So, in the form of a trauma, in the form of any accident. So, when the cause is external and local disease happens to be there, the first important thing is the use of auxiliary measures, if needed, the surgical measures. And third important, if the dynamic effect which is produced because of that trauma, that accident happens to be there, then you have to give internal homeopathic remedy. So that's what the homeopathic management of the local disease due to the external cause. But the local diseases which are caused internally, dynamically, requires little bit big importance, as well as you have to be very careful and watchful in treating those diseases. And he has given maximum aphorisms and he has spent maximum time to explain the local diseases caused because of the internal causes. So he has started explaining about how to manage them. Old school actually have explained regarding this as considering the local diseases have local causes, they and they have explained it regarding the local treatment only. So they never consider the cause is internal. They never consider the vital force as the affection and which is expressing externally on external most aspects. This they never consider. And that's why the treatment is aimed at the local part. For example, the gangrene is treated locally by amputating the part. Eczema is treated by local application. And what happens because of this wrong interpretation or wrong concept and wrong treatment, the disease travels from less important organ and it enters inside, involving the very vital organs, causing a damage to the internal big organs. So patient may have developed the problems in the brains, problems in the heart, problems in the lungs, GI tract, depending about his susceptibility, but the disease travels inside. And this happens only because it has been treated externally. And that's why Dr. Samuel Hahnemann explains, if you are treating those local diseases which are caused because of some dynamic internal disorder, should be treated only and only with the internal line of treatment, considering the whole human being. They are not local diseases caused because of local cause, but they are caused because of the internal human disorder. So we have to take into consideration the whole human being while treating those disorders. This is what we have learned in earlier lecture. We have finished up to the 190 aphorism. Let us go ahead. What he wants to explain about those disorders in detail. We'll start with 191. This is confirmed in the most unambiguous manner. Unambiguous means asandigdha, spashta. This is confirmed in the most unambiguous manner by experience, which shows in all cases that every powerful internal medicine, immediately after ingestion, causes important changes in the general health of such a patient, and particularly in the affected external parts, which the ordinary medical school regards as the quite isolated, even in a so-called local disease of the most external parts of the body. And the change it produces is most salutary, being the restoration to the health of the entire body, along with disappearance of the external affection, without the aid of any external remedy. provided the internal remedy directed towards the whole state was suitably chosen in a homeopathic sense. See what he wants to explain. This is one sentence, but in one sentence he has explained how to find it out a remedy or how to treat such types of disorder. So what he explains to start with the sentence is very important. He explains over there that all the cases that are every powerful internal medicine immediately after its ingestion causes important changes in the general health of such a patient, and particularly in the affected external parts. Even in the so-called local diseases of the most external parts of the body, the changes it produces is most salutary, being in the restoration to the health of the entire body. So when you prove the drugs on the healthy human beings, so for example, you are proving the remedy in the healthy human being. When you give that dose to the human being, it starts producing its own symptoms. It produces functional symptoms, functional manifestations, and which are produced at the most external level. There might be a itching which has started, there might be a pain which has started, and which is external manifestation. Medicine is given internally. Medicine acts at the dynamics, producing the lesions, or not the lesions, but the functional manifestations at the periphery. In the similar manner, the local diseases happens to be there. They are caused because of your internal vital force gets affected because of any reason. And once your internal vital force gets affected, it starts producing its manifestations peripherally on the skin or the most external part of the person. If you match it out a right remedy, if you take the totality of the symptoms, if you find it out a right remedy on the basis of that totality of the symptoms, and you give a right remedy to that patient, then that patient will be cured with internal treatment. There is no requirement of any special local remedy over there. We'll take a simple example. A patient comes to you with eczema over hands and feet. It is typical eczema and it is tremendously itching and burning. And patient tells you that, doctor, I have to keep my extremities in cold water, then my itching gets settled. Otherwise, the itching is so severe that I goes on scratching and scratching and scratching until it bleeds. And this is what happened. This is the thing which has happened because of it. And you can see that there is scratches are there is an ulceration, there is a bleeders, and that eczema, the thickened skin. He has explained you all the details, and you took this totality. Now, if you are a homeopath, what you are going to do? So, what totality you will take into consideration? Which are the symptoms which will guide you towards the remedy? Any idea, any thought? Here, eczema never matters. Here, eczema is never matters. What matters is the symptomatology, the individuality which is expressing through his eczema. So, itching aggravated by scratching, scratches until it bleeds, then burning, ameliorated by cold application. So these are the things which are very essential in order to find it out a remedy. So your remedy never depends upon diagnosis, eczema, but your remedy is based upon the individualistic features which are his own, that individual's own. So remedy might be a sulfur because you are matching the totality of the symptoms for that case. It never depends that you have given the remedy for the eczema. You have given the remedy for the person who is suffering from eczema because he is expressing the individuality of the sulfur. This person where you have given the sulfur was a dirty looking. He never cares about his hairs, he is not careful about his dressing, and he comes to you. So there is one more thing which you can observe and you can find it out a remedy. What is the rubric? If he is dirty looking,
Indifference to personal appearance.
very correct. Indifference to personal appearance. Only remedy in Kent's Materia Medica is, Kent's repertory is sulfur. Another remedy you can get it in coca, in synthesis or complete, but coca is different. Coca is, because coca is in different world. When he takes the cocaine, he goes into different world. Therefore, there is nothing matters. Dressing never matters, or nothing matters regarding his appearance. That is the coca. So it is a different symptomatology. In sulfur, being a knowledgeable person, still he never looks towards his dressing, its appearance, and that's why it is sulfur. So you have not given remedy for eczema, you have given remedy for the person who is having an eczema. And this is our aim in treating the local diseases. We'll take one more example. A patient is brought to you with a severe pain in his fingernails. There are severe pains over there, and those pains, there is a, as if it is a panaritium, the pains are going in upward direction over the whole limb, whole upper extremity, and patient, it's too sensitive. Those are neuralgic pains, and he feels better when he goes out in open air, and when he comes into the room, the pains gets aggravated. This is the patient with which patient has appeared to you. So what you will think in such types of patient, and there is a panaritia. That is there are eruptions around the nail bed, and it has infected, and now the patient is having all types of pains. So you will never prescribe on the panaritia. You will never prescribe on diagnosis, but you will prescribe upon the symptoms which the patient presents. These are neuralgic pains which runs in upward directions in a whole upper extremity. They aggravated inside the room, ameliorated in open air, is Allium-Sipa. It is very typically mentioned in Allium-Sipa. So you're going to give Allium-Sipa internally. You will not going to give the Allium-Sipa as a local application over there. So you have to think about the modalities where the person is expressed through his modalities. Person is expressed through this location, sensation, modality, the concomitant, and you're going to prescribe the internal remedy and not the local any remedy for that patient. And this is what he wants to explain over there. Even though the disease is local, your treatment should be aimed at the center. And this is what he explained, provided the internal remedy directed towards the whole state was suitably chosen in homeopathic sense, that will bring that patient again into the state of health. We'll turn towards the 192. This is the best effected when in the investigation of the case of disease, along with the exact character of the local affection, all the changes, sufferings, and symptoms observable in the patient's health, and which may have been previously noticed when no medicines had been used, are taken in conjunction to form a complete picture of the disease before searching among the medicine, whose peculiar pathogenetic effects are known, for a remedy corresponding to the totality of the symptoms, so that selection may be truly homeopathic. So what he is explaining? Many a times, those patients who comes to you for the local diseases, they have already consumed lot of allopathic treatment. Many times it happens. Patient comes to you with eczema, and he is having that eczema since last 4-5 years, and he was applying the Tinovet ointments many times because that was the only ointment which was giving him better feelings. What has happened? Because of continuous use of local steroids over there, now there are no symptoms remain. The symptoms are vanished. Now what remains over there is the only objective sign, that is eczema. In earlier case where I have explained the modalities over there, that it is aggravated by it is burning, scratches until it bleeds, then patient keeps it in water. These such types of symptomatology is now no more there. Now patient comes, doctor, this is not looking good and this is the problem. That's all. Now the case becomes difficult, one-sided local malady without symptomatology. Now it becomes difficult. So what Hahnemann sir tells, that here you have to find it out. The first, what is present totality? Then you have to ask the patient that when the disease has started, how it has started. What were the symptoms which were present at the time of start of the disease? If you get that totality, if you get that symptoms, you will get exactly the modalities. You can get exactly the sensations. You can get exactly the concomitants, which are useful in finding it out the right remedy for the patient. And that's why if you want to make a totality in these cases, then you have to take into consideration the two totalities. That is the present totality along with the previous symptoms which were present before any allopathic medicines have been used. So those were the pure symptoms. And then you make your totality. And on the basis of that totality of the symptoms, you have to find it out a remedy. So he has given a way how to find it out remedy in one-sided local diseases where there is a lack of symptom. So present totality plus, plus the previous totality before taking any allopathic treatment is equal to the complete totality. And on the basis of that, you have to find it out the right remedy for the patient. So see how nicely he has explained or taken into consideration all the aspects, and then he turns towards the 193 and what he explains over there. By means of this medicine employed only internally, the general morbid state of the body is removed along with the local affection, and the latter is cured at the same time as the former, proving that the local affection depended solely on a disease of the rest of the body and should only be regarded as the inseparable part of the whole, as one of the most considerable and striking symptoms of the whole disease. So if you find it out a right remedy on the basis of this complete totality, and if you give that remedy to the patient. So the patient who was brought to you with eczema without any symptoms, and you have find it out all symptomatology considered the previous totality, and you get the right remedy, and you have given that remedy to the patient. What will happen? If, for example, you have selected meserium, consider that meserium is the totality, and you have given meserium. Meserium will not going to produce or are going to clear only the local affections. Meserium will going to work at the center. It will relieve the whole human being. The disturbed vitality inside the human being is first get settled because it is the simillimum which is most matched with the patient's totality. And then once the vital force is recovered, automatically the external manifestation of its disturbance automatically starts coming down or starts disappearing, and patient again regains the state of health. It is not like that when you apply the local application and it temporarily disappears and again it reappears. It never happens because you have treated the whole human being. You have selected the meserium on the consideration of that human being and not only on the local lesion. So your remedy is best considering the total human being, and your remedy works on the human being and not only on his lesion. And if it happens, then that patient definitely gets cured completely forever. The reason behind this is only because we used to consider the whole human being, but when you deal all those cases allopathically, they consider it as a local disease and they try to palliate it with the local applications. So Hahnemann's concepts in treating all those diseases, local diseases, is very clear that you have to treat local diseases due to the internal cause with low internal medicine or internal minimum based on the totality of the symptoms and based upon that human being. So I think we'll stop over here. Tomorrow we'll continue with the next aphorism. Till that period, we'll stop. We have discussed three aphorisms: 191, 192, and 193. If queries are there, we'll have a chat. Otherwise, we'll conclude the meeting. Any query, question?
सर
Huh?
सर वो एक सोरानम केस था जिसको हमने एक वीक के लिए हमने दिया था ना यूएस में हॉकिंग का केस था उनका क्लियरिंग थ्रोट एवरी टाइम एंड म्यूकस वो उनका एक हफ्ते बाद उनका मैसेज आया कि हॉकिंग इज मच बेटर बट म्यूकस इज स्टिल वो कह रहे हैं कि वो बन रहा है थोड़ा बहुत ना तो आपने वो 3 डोजेस के बाद उसको स्टॉप करवा दिया था कि एक वीक के बाद हम उसको वो लेंगे तो अब उनको हमने आगे किस तरह से कंटिन्यू करेंगे
Wait for one more week because Soranum is deep in action. It is a nosol.
राइट सर
So there is no need to repeat it immediately. Just wait for another week. Let us see whether it is going in same direction. If it is coming down and patient is getting settled, there is no need to immediately repeat. We'll wait for another week. Take follow up after a week.
राइट सर
That
सर
will
एक केस है उसमें वो उनको इंजेक्शन एलर्जी का इंजेक्शन सिंपल इंजेक्शन लगवाने गए थे अब दुबई के अंदर ही लिव्स इन दुबई और उसके बाद उसी वक्त उनको बहुत शदीद तकलीफ हुई और उनका पूरा हाथ जो है ना वो नमनेस उसमें आ गई और अब 1 साल हो गया वो ये कह रहे हैं कि वो उसने मुझे गलत इंजेक्शन पॉप इन किया और अब जो रिस्ट से आगे जो आप समझे कि पूरी फिंगर्स हैं वो बिल्कुल ही मूव नहीं कर पाती हैं ही कैन नॉट होल्ड एनीथिंग मतलब उसमें कोई जान नहीं है और वो कहते हैं वो मतलब वो बिल्कुल से वो बेजान सी लगती है मेरी रिस्ट जो है उनको किसी ने आर्निका सजेस्ट की थी ही स्टार्टेड यूजिंग आर्निका बट नो यूज उसका कोई रिजल्ट अच्छा नहीं आया तो और चूंकि बाहर रिपोर्ट्स वगैरह देते हैं वो लोग तो उन्होंने कहा मेरे पास ऐसा चली कोई रिपोर्ट्स वगैरह नहीं है
So what do you think? What is the rubric? If you tell me the rubrics, then it will be better. क्या rubric आएगा?
Delusion wrong suffered.
Very correct. Very correct. The rubric is delusion wrong as suffered. If the patient says like that,
right
yes, it is very clear delusion wrong as suffered. If the patient
right sir
patient if talks in that sense, you have to think about delusion wrong as suffered. Then you have to decide one of the remedy from that. Then how the patient
right
reacts. The seminar which I have taken last time, just go
Yes,
through
sir.
that
It was
and
very
find out.
beautiful, sir.
Hmm?
It
Last
was
yes
very
sir
nice, sir. Last time took all the differentiation of drugs and the delusion wrong suffered. You explained it very nice.
Go through that, find it out which simillimum matches. What was the patient's reactions and find it out the remedy.
right sir
Okay. Another clear cut, if it is definitely because of injection, then you can think of a remedy. Which remedy you will think?
Hypericum.
Why?
Injury to nerves, maybe.
Another remedy which it is because of pricks. Let them fall.
Let them fall.
It is because of pinpoint things. Let them fall
Yes,
is
sir.
a very important remedy in such types of cases. Yes. Okay. Any other question, query?
Sir, sometimes the patients come and they ask for can you give some medicines for alcohol to stop the alcohol? Means the patient will not come. Their IPR will come and they will tell and they will take the medicines from Ayurvedic and all and they will tell that you only give the medicine. Means without that patients, they
Knowledge.
will not bring the patient.
This
Most
is
of the patients ask like that, sir.
no, don't give anything. Because problems might occur medico-legally. Someone can blame you.
Yes, sir.
So if ask them, yes, there is a treatment in homeopathy to stop the alcohol, but I will give the remedy if the patient comes over there. It is with the patient's will you can treat. Without patient's will you don't treat. Because so if that fellow had some problem after taking that, and if he says that you have given me poison, what will happen? It will
Yes,
be
sir.
medico-legally problematic. So don't give such types of medicines. Without knowing, don't give medicine. This
Okay,
keep it
sir.
in your mind always.
Yes.
Okay. So thank you being there,
Thank
everyone.
you, sir.
We'll meet tomorrow again at the same time. And it is a good moment that this discussion I like more than that the aphorism, just explaining the aphorism, because it is very useful for the practitioners. So thank you being there, everyone. We'll meet tomorrow at the same time.